Hi, my name is Marisa Salisbury. I'm an epidemiologist with Merck, and I'm going to be talking to you about a new test that will help you as clinicians diagnose your patients with a certain enteric disease. So we're going to be talking about the enteric disease immunostotia. Immunostotia, or ISA, is a gram-negative bacilli. As I mentioned, it's part of the enteric family. So it's similar to E. coli, or to Shigella. And we're looking at specifically patients that may be presenting with diarrhea, nausea, lethargy, and especially with a history of contact with a contaminated water source. So this could be someone that's traveled overseas where there is not unfortunately, a clear distinction between a sewage and drinking water. This could be a situation like we've seen in the South of flooding in the United States, and this could also be a situation where someone has gone camping and did not verify a potable water source. So ISANEW is the name of the diagnostic test that's going to help you determine if you're a patient that's presented with that signalment, that's presented with that positive history, whether they have ISA. So ISANEW is a diagnostic test, and I'm going to go over with you shortly of why it's specifically a diagnostic test versus a screening. You're looking at patients that are presenting with certain symptoms and have a positive history. You're typically going to run ISANEW as part of an enteric panel. It's not normally going to be something that is going to be ran by itself, but with something else. And let's talk now about the test here for just a moment. So when I researched and developed and put my blood, sweat, and tears into getting ISANEW out to you, we looked at a population of 10,000. And out of the population of 10,000, we found a prevalence of 14%, which would be 1,400 out of that 10. Okay, so looking at that prevalence rate, the first thing I wanted to look at was, let's see what the sensitivity is for ISANEW. So the sensitivity, again, just to remind you, is the likelihood of testing positive with those actually that do have it. We, again, we have a 91% sensitivity. As far as it goes for specificity, or the likelihood of testing negative and do not have it, we found that that's roughly 16% of that 10,000 population with specificity. Now, this is why this test worked better as a diagnostic test as opposed to a screening. So you're looking at whether or not the patient, again, is presenting to you with the signalment, with the positive history, and you're trying to determine part of an enteric panel of whether ISA is the potential disease that you have to treat for. Okay. So the positive predictive value is 15%. So we're looking at those that have the disease and that tested positive. Okay. This is where it comes in handy right here for the negative predictive value. The negative predictive value is 92%. So these are the people that do not have it and tested negative. If you're looking at all as an enteric panel and you're trying to determine which antibiotic, or maybe you're trying to figure out what you need to culture for specifically, this particular ISANEW, this test would allow you to determine if you should be ruling out ISANEW, okay, or ruling out ISA, through ISANEW. So who would you use this for? Why am I standing before you with Merck, and why am I suggesting for you to use ISANEW? So the first thing is you have a patient presenting, and since the signalment, the symptoms are vague, you're looking for that positive history along with those indicators. So malaise, lethargy, diarrhea, nausea, vomiting, anything like that, along with the positive history of that they could have ingested contaminated water, you'd want to make sure the ISANEW is part of your enteric panel. So you're looking at blood sampling, which can be done through any laboratory, and then the test would be sent to us at Merck. You want to rule out ISA. Okay, so you're looking at ruling out this gram-negative bacilli. And I do want to tell you, we are looking at the development of actually a screening test. And the screening test will be much more useful in situations maybe where there's flooding, and we have the potential to have a larger amount of patients with this particular bacilli, and that will be coming at a future date. So I appreciate you listening to my information about ISANU, and I hope that it's of value to you and your patients. Thank you.